Hey, health junkies! It's time for The Health Fix. Join your host, Dr. Janine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause. Today's episode is all about the period. And I'm going to be interviewing Dr. Lara Briden. She's a fellow naturopathic doctor just like me. She graduated from the Canadian College of Naturopathic Medicine back in 1997. That's a good 10 years on me, and so she's got a lot of information for you. We're going to talk about her book, The Period Repair Manual, and go into how you can fix your own period problems. So, without any further ado, let's get on to the podcast. Hey there, health junkies. Welcome to another episode of The Health Fix. I have Lara Briden, another fellow naturopath, online with me today, and I can't wait to dive into talking all about hormones with her. So, Lara, hello.
Hi, Janine. Thanks for having me.
Hey, my pleasure. I'm excited to chat about everything hormones. So, tell my audience here, how did you get into becoming the period revolutionary? How did this come about?
This came out of, I guess, what's more than 20 years now of work with women, helping them to have better periods with diet, nutritional supplements, herbal medicines. It's all a lot easier than most people realize. And, realizing that also that women needed other solutions because all they're really being offered from conventional medicine is the pill, which, as we can talk about today, is not a solution for most period problems. And so just my work came out of that, just realizing, we need a whole paradigm shift, a revolution in how we approach women's health.
I love it. I have referred a lot of people to Lara's blog. She's got a great blog with a ton of great topics, pretty much everything you can imagine having to do with hormonal imbalances, period problems, things of that nature. And of course, her book, The Period Repair Manual, is amazing. And we'll get to that in a little bit. But I want you guys to get to know Lara a little bit and kind of hear, we talked a little bit before we started recording about the main things we see in the office. And you already mentioned one right off the bat is using birth control to basically cover up issues such as acne and irregular periods. What do you commonly see people coming into your office for in terms of they've got the birth control pill and it's been prescribed because of what?
Exactly what you said. Skin is probably a big one, which is really crazy because the skin responds to so many other treatments, as I'm sure you know. We can talk about that. They'll come in on it for PCOS, which is also an inappropriate prescription because the hormonal condition polycystic ovarian syndrome can be masked by the pill, but is potentially worsened by the pill. So we can talk about that. Often women might be prescribed it for period pain or heavy periods, again, which there are other solutions for. To prescribe the pill for period problems is a Band-Aid at best, but it's the biggest problem is that it masks some of the underlying problems. It works by shutting everything down. So there's no opportunity to balance hormones because there are no more hormones. The pill induces essentially what could best be described as a state of chemical menopause or zero hormones. And then, being replaced back with these contraceptive drugs, which are, to be fair, not even as nice as the hormones that are given to women in menopause. So it's even as a type of hormone replacement, contraceptive drugs are substandard.
Wow. I had never even thought about that. A lot of people are all freaked out about the synthetic versions of hormone replacement therapy, but the fact that birth control is worse than that, I think that's a huge thing that I think a lot of people don't put together.
Yeah, I've thought the same thing. We know we've had so much controversy and anxiety about should women in menopause take these synthetic hormones, most of which now are actually natural hormones. Even in the conventional world, most menopausal hormone replacement is switched to the natural versions. But meanwhile, we've got millions of young women who should have been able to just make their own hormones and enjoy the benefits of that, who are instead being given this type of essentially HRT, which is causing problems. I mean, it causes, I guess, one of the biggest side effects of the pill, that the one I see and the one that concerns me the most is its impact on mood, which is not surprising because hormones affect the brain. So, of course, these contraceptive drugs affect the brain, but not in the same way that our own hormones do. The progestin part of birth control is particularly problematic for mood, and several lines of evidence and research have suggested that it's the progestins that can contribute to anxiety and depression. And that's certainly what I see with my patients. One of the first things women often will observe coming off the pill is, oh my goodness, I feel so much lighter and brighter and my mood has shifted.
Yeah. It is funny how you mentioned that. I think mood just in general is something around the period, whether you're on birth control or not. It seems that mood is a big issue related to hormones. And I noticed your blog post about the progestins and the comparison that basically you're saying is that progesterone is not a progestin. This is a very different molecule here.
Yeah.
Tell us a little bit about that, because I think a lot of patients still, even though I'll say, no, I'm going to give you a progesterone supplement in terms of a pill, they're like, no, I don't want that. I had the depot shot years ago and I
know.
And I'm like, no, it's different. It's different.
I have one blog post called The Crucial Difference Between Progesterone and Progestins. Mm-hmm. And I think I started that blog post by saying something like, if you learn one thing from my blog, let it be this. This is one takeaway message for everybody. The progestin drugs, contraceptive drugs of hormonal birth control, are not progesterone. It's a really important distinction. And I guess just to put it in context, estrogen is a generic term. So the word estrogen can refer to the synthetic estrogen in the pill or our own estrogen, such as estradiol is the main estrogen that we make. So estrogen is used quite broadly to refer to several different things. So then, of course, we think, logically progesterone can be the same thing, but it's not. Progesterone is very specific for the hormone we make or the natural progesterone we can take in different forms, but that's called natural progesterone or micronized progesterone or bioidentical progesterone. All the other progestin drugs that are often referred to as progesterone, but they shouldn't be, they're drugs like levonorgestrel and drospirenone, and they are quite different from progesterone. A good example is the progestin levonorgestrel, which is in the Mirena, it's in the Hormonal IUD, it's in many different pills, it's in one of the implants, it's the morning after pill. It's called levonorgestrel. It's derived from testosterone, and it's actually more similar to testosterone than it is to progesterone, which is why it can cause testosterone side effects like hair loss. That's one of the other big ones from these progestin drugs, is the insidious, sort of slow burn of hair loss, which is actually almost impossible to reverse, unfortunately, after a few years. The skin breakouts that you can get from certain types of birth control, and potentially the breast cancer risk. I was just reading something last night, which is very interesting, about looking into why progestins have a breast cancer risk when progesterone does not. Actually, progesterone seems to be protective for the breasts. And the reason potentially is that at least some of the progestins have an androgen or a male hormone effect, which is not healthy for the breasts and it's not healthy for metabolism either. Exposure to excess androgens or male hormones can worsen, make us more prone to metabolic problems like insulin resistance. And so this would, to say that progestin drugs are good enough for women's health would be like saying to men, okay, we're going to give you this drug to shut down your testosterone, and then we're going to replace back, a testosterone-like drug, which is actually a little bit more like estrogen, but, that's good enough for you. That's just what you're going to have to deal with. Obviously, that would not be a good fit with their bodies, and that's why these progestins, especially the androgen-type progestins, are not a good fit with our bodies. The brain doesn't react the same way. The skin doesn't react the same way. The hair, just everything, the immune system. We have a correlation between contraceptive drugs and the risk of autoimmune disease. Mm-hmm. And that's because we don't get the benefits of progesterone for balancing immune function and preventing autoimmune disease.
Oh my goodness. I had no idea. I did not know that connection there with the autoimmune disease.
Yeah.
Oh man. further reason why I am going to be making sure I keep taking my progesterone each night.
Yeah. Natural progesterone can be helpful in certain situations, yes. Especially during, well, to speak from my own experience, of course, I'm close to 50. So during those perimenopausal, those end of period years, natural progesterone can be quite helpful. And in part for its balancing effect on immune function.
Well, I'm sure loving it. I am in my 40s now, and I just turned 40 last year, and all of a sudden, my progesterone kind of dropped off the face of the earth in terms of my levels, and I went, "Oh, okay, guess this is getting real now." So
I call it the great progesterone crash of perimenopause. I have a couple blog posts about that. Because our brain, progesterone has such a usually beneficial effect on the brain, and what's called HPA axis, or the stress response system with the adrenal glands, that when we lose progesterone in our 40s, we have to recalibrate that whole system, and that can make us more vulnerable to stress and mood symptoms and sleep problems during perimenopause.
Oh my goodness. Yeah, no, that is, I feel like sometimes, and I don't know if you notice when people come in your office and they're just so irritable and they're so angry with life, and they're like, I'm getting a divorce. I used to like my husband like 5 years ago, but I hate him now. I'm like, okay, let's just get you some progesterone, honey. let's test your levels and let's see where you're at, and let's just make everything calm and happy again. Oh man. But yes, that is something I do see as well. So let's talk about the autoimmune disease connection here with birth control, because for a lot of my ladies, and I'm sure you probably see this too because of being on the fringe of society as a naturopath, a lot of folks will come to us and be, in that interest of, okay, I want to get off the pill, but how do I do it? How, and they're kind of teetering between, is it good for me? Is it bad for me to be on the pill? What is your chat with these folks? I know that you have a blog post in terms of, here's how to get off the pill. I would love to hear it from you today. Kind of, what's your speech? Do you talk a little bit about the autoimmune connection? How does it go?
Well, my main position is that contraceptive drugs induce a chemical menopause, and they rob us of the hormones that we need for general health, not just to make a baby. So when that is the starting place, when I can communicate to my patients that, okay, actually you would benefit from your own estrogen and progesterone in terms of all these things of mood, immune function, gut microbiome, muscle mass, metabolic rate, thyroid. These are all the ways that estrogen and progesterone benefit us, and contraceptive drugs don't give the same benefit. Then, most women are pretty keen to regain their own hormones, basically, to reclaim their own hormones. And so that's the motivation.
Makes sense.
And then the very next step when deciding to come off hormonal birth control is what were your periods like before, your real periods? Because another really important takeaway for your listeners is that pill bleeds are not periods. So essentially they're just drug withdrawal bleeds that happen with the pill. They don't actually there's no reason to have them happen monthly. The whole monthly bleeding on the pill thing is just complete nonsense. It always was. I mean, if you're going to be on those contraceptive drugs, you really can just stay on them all the time or have the occasional withdrawal bleed. It's, the monthly was a smokescreen, just kind of thing to convince women that it was somehow similar to a cycle, which it isn't. There's no cycle. Yeah. with the pill.
Absolutely. Absolutely. I think one of the things that I often hear from ladies is like, well, isn't it like I'm detoxing once a month? And I'm like, well, no. It never really makes sense to me.
No. I mean, the only reason, someone did point out that I guess potentially having a monthly bleed on the pill, you get a little bit less of the exposure to the drugs, in that you're taking a week off every month. So just your total exposure to those drugs is less, which I guess is a little bit better, but it's so much better to not have the drugs and instead make your own hormones. So sure. I don't see, and then having the monthly bleed is just annoying. And there's really no reason to bleed monthly on the pill, but there's many reasons to have a monthly menstrual cycle, which is primarily to ovulate and make hormones that we need. And then that monthly ovulation results in a monthly bleed. I see the period as just an inevitable outcome of an inevitable downstream outcome of the main thing we want, which is monthly ovulation for all its many benefits. That's the way I view it.
I like that.
So in answer to your question, like, what is the procedure? Like, it's really important to have a conversation about what were your periods like before, like your real periods, like what was actually happening with your hormones before you ever took hormonal birth control, or when you tried to stop it before, because then you know what you're dealing with. That symptom hasn't gone away.
Mm-hmm.
It was just masked, if anything, or worsened potentially. So that would be true for skin, especially trying to come off one of the drosprenone pills like Yasmin. There's something called post-pill acne that after that particular drug, which is potentially worse skin than you ever had before.
Oh, lovely.
Because of the withdrawal I have a blog post called How to Prevent and Treat Post-Pill Acne. It talks about why that withdrawal syndrome gets set up, why skin is so bad about 3 to 6 months after coming off that particular pill.
Ooh.
So if the problem is skin, then you have to make a plan for skin, and you put the plan in place before the withdrawal symptoms really take effect, so that it's easier to prevent skin problems than it is to treat them. Once those breakouts are there, they have a lifespan that's of a few months. So other symptoms that might have been present before is period pain. Mm-hmm. That really needs to be taken seriously, because there's a chance that is endometriosis,
mm-hmm.
which is endometriosis, which I hope your listeners probably know. It's a inflammatory disease of the pelvis. One of the symptoms it causes is very painful periods, but that doesn't mean it's just a particularly bad period. Like it's its own thing. It's its own entity. It's an inflammatory disease, requires a particular set of treatments. Conventional medicine is not in the right place with this right now. I mean, their treatments are surgery, and for endometriosis, surgery and hormone suppressing
mm-hmm. Mm-hmm.
medication, which, if it can give relief, then I'm not opposed to women having that, but there's so much more to the disease, which I talk about in a recent blog post called Endometriosis, Treat the Immune System. So if my patient has, for example, had what I perceive as quite severe endometriosis symptoms before she went on birth control, and if the birth control has managed to control it, because it doesn't always, then in that case, I might actually say, let's stay on the pill just for a few months while we work on some of the underlying inflammation and get you to a better place before subjecting you to the return of endometriosis symptoms, which I don't think anyone should have to endure.
No.
It'd be quite bad. So that's endometriosis. And then just another very real possibility when considering coming off the pill is that there were no periods come.
Mm-hmm.
So the question is, did you have regular periods before you went on the pill? And if the answer is no, there's no reason to think they're going to be regular now. A lot of patients say to me, I stopped the pill and I lost my period. It's like, no, okay, remember, those pill bleeds were not periods. So you stopped the withdrawal bleeds, and your own system was not ovulating regularly. So, and in fact, it's probably less likely to be able to ovulate regularly because you've been on an ovulation suppressing drug. So now we need to try to work out what's going on with that. What was the underlying reason for irregular periods? It's usually it could be lots of different things. I talk about doing blood tests in my book, Period Repair Manual. Chapter 7 is the biggest chapter in the book. It's all about irregular periods, how to talk to your doctor, how to get the right diagnosis. But usually at the end of the day, for most women, it comes down to one of two things, either PCOS, which is the whole body hormonal condition, nothing to do with cysts on the ovaries. And the second thing is hypothalamic amenorrhea or undereating, which is unfortunately becoming more and more common with the clean eating movement. And, women, really confused as to why they can't get their period. And it's probably because they're not eating enough or enough carbohydrate in particular. That's something I see quite often now.
I also see that quite often.
Yeah.
I mean, and this is something that I've noticed in a lot of your blog posts, and something that I'm all about, talking with folks too about, is dairy and the whole concept of keto. Because it seems like folks who go on keto, they become cheese and meat-itarians. And it's like, I had string cheese for lunch, and then I had it for a snack, and then I had Parmesan crisps with pepperoni, just something. I'm like, oh, man. And then they're like, and now I can't get my period. Or it's, and it's either I don't get my period anymore or my periods are horrible. I bleed forever and I have so much pain. And dairy.
So there's two things happening there. So, well, one, we'll talk about dairy first, I guess. That's dairy. One, dairy can make periods heavier and more painful and more difficult. The second thing going on potentially with the keto diet is just the absence of starch, because we do need, as women, as young women especially, it would be more for women in their 20s and early 30s. I think as we get older, we have a sort of differently calibrated system. But for young women, the hypothalamus, that's the part of the brain that controls periods, is waiting for a certain amount of glucose, starch, insulin release to signal to the brain that there's enough food, so the brain decides to promote ovulation. And there's hardly any science on it, which is an example of how little science there is into women's bodies. We're treated as a side issue, kind of a niche topic, when I like to make the argument that the female body is the normal version of a human body. There should be more research into how it works, including how ovulatory cycles or female hormones work. But there's some evidence, some science that, to support this idea that we need a certain threshold, it's different for every person, but a certain threshold of glucose or starch coming in to trigger ovulation. And so with a keto diet, you're potentially just below that threshold, never going to see a period for some women. Yeah, and on the dairy side of things, having a lot of dairy can make periods worse, mainly because of mast cells or histamine release. And I have a blog post about that called What Dairy Does to Periods, and a couple blog posts about histamine and mast cells and periods.
I love how you outline that, because I think for a lot of people, one, the difference between Holstein cows and Jersey cows, so the A1, A2 components there are really important. So those of you out there that are listening to this, it's based on the cows, and that's one thing. And then the histamine level, so inflammation. I think a lot of people don't think about the histamines, especially when related to headaches. Do you find that if I saw in your blog post you're talking about limiting histamine foods. Do you find that limiting the histamine foods like a week, 2 weeks before the period comes, or just completely keeping the histamine foods out for a while till you can get ovulation and everything else back set works best?
No, it's the first thing. I think if the main problems are premenstrual symptoms, like premenstrual headaches, maybe hives or flushes, fluid retention, irritability, because of course histamine is a neurotransmitter as well as an immune. It's a neurotransmitter. It's a hormone modulator. It's part of the inflammatory response. It's an immune system component. Yeah, histamine can be quite overstimulating. So irritability, insomnia. If those are all part of the premenstrual picture, then sometimes I think it works to just focus on dialing down histamine during that time, during that vulnerable time, premenstrual time, and probably being able to tolerate them more in other parts of the cycle. If dairy is a significant issue and is affecting mast cells and is a major triggering histamine release, then bigger picture, I think some women benefit from avoiding normal cow's dairy all the time. But as you say, they're usually able to have A2 dairy, which would include goat and sheep, and the Jersey cows, or the A2, the breed of cows that have only the A2 casein.
So let's talk about headaches around the period, whether they're premenopausal, whether
premenstrual.
Yes, clearly I have menopause on my mind. But menstrual, like premenstrual headaches. It seems that there are so many women that either have headaches or they'll go full on into a migraine. Tell us what you've found to be beneficial in terms of balancing out the hormones in this case. What kind of tricks that you use, things of that nature.
Yeah, so I'll refer again to a blog post and then I'll describe it a bit. But the blog post just gives that little bit of extra information. I have a blog post called How to Treat Hormonal Migraines. And I talk about non-migraine headaches as well. So it's not just about that. One of the first points I make in that blog post is that hormonal birth control worsens or causes migraines or headaches. So first off, if you're getting so-called hormonal migraines and you're on birth control, they're really just side effects of those contraceptive drugs. So it's probably worth trying some time without them. Another good reason to potentially try some time without hormonal birth control. Doctors aren't supposed to actually prescribe the pill for migraine sufferers, but they still do, which is concerning. Because it's not just that hormonal birth control, the pill in particular, worsens migraines. It's that women who are prone to migraines have a higher blood clot risk with the pill. So the pill is not safe for them for a few reasons. So that's number one point. But for all the women who aren't on the pill and are still getting hormonal premenstrual migraines, it's a lot to do with losing progesterone in the last few days of the cycle. Usually there can be different things going on depending on when the migraine actually happens relative to the period. But let's say for the migraines that come on just before the period, that's when progesterone starts to drop. And progesterone, the brain loves progesterone. The progesterone has a very calming effect on the brain usually. And that's why I'm sure you've seen with your patients that natural progesterone supplements can be wonderful for preventing migraines. Usually I'll say take it during those few days before the period and into the first few days of the period during the migraine danger window. And at the same time, it's really important to put in place some magnesium, because magnesium stabilizes the brain and prevents overactivation of the nervous system. So magnesium, I talk about using magnesium with an amino acid called taurine, which is also very calming for the brain. It's a neurotransmitter as well as an amino acid. And also looking at reducing histamine, referring back to our earlier conversation, because histamine can be a migraine, not just trigger, but promoter. And then migraines are interesting because you can get, it's worth mentioning, if you get a migraine or a headache at the end of your period, not premenstrual, not in the first couple of days, but just around the time the bleeding stops, that's actually been linked to iron deficiency. So it just gives you an interesting way to put the detective hat on and think about migraines. So that can be I've seen that in a few patients now that I know to look for it and, measure their iron and see, they're really borderline iron deficient. That just depletion of their iron with the period just pushes them over into migraine territory. So then the fix is to bring iron levels up. And another migraine treatment that, before I forget, worth mentioning is melatonin. It has an anti-inflammatory kind of stabilizing effect on the brain and has been clinically trialed for migraine prevention, and as far as I understand, outperforms the conventional medications for that purpose.
Wow. And how do you dose it? How many days in do you start using it, and what's the dosage?
Yeah. Well, with my patients, I'd say usually maybe just take it, obviously at bedtime during the premenstrual phase. Okay. And I tend to go lower with melatonin. I can't recall what dose they used in the clinical trials, but I think it was in the 1 to 3 milligram range. So not a huge dose.
Yeah. No, and I have not tried that one. So that's a good one. That's a good pearl there for me to try with some of my folks. I think the other thing, PCOS, of course, is a huge one that a lot of people come in and, I'll run their hormones. Speaking of which, and I'll see their hormones, especially testosterone being elevated, which is one of the hallmarks. I typically test between day 19 and 26, and I will vary between blood and saliva depending on what my patient can afford. What do you prefer? Do you prefer blood or saliva for hormone testing? Or urine at this point?
Yeah, I prefer blood.
Okay.
For a couple of reasons. Well, one I'll just say it's, at least in Australia where I've been practicing, it's far more affordable. The blood testing, and you can get a lot of information from some basic blood testing. So I prefer blood. And I will do probably day 1 or 2 of the cycle. And then if I want to get a progesterone reading, then I'll do mid-luteal or about a week before the period.
Gotcha.
And you can test other things with blood too, but like anything PCOS related, you really need to know insulin and prolactin and a few things that you can't get from saliva. Also, I've had concerns about the accuracy of testosterone on saliva tests. Now, I may need to update my information, but certainly 10 or 15 years ago when I was doing some saliva testing for testosterone, I would occasionally pick up these bizarrely high testosterones when it just didn't fit the clinical picture at all. And then I had the piece of information that depending on your mouth, your oral microbiome, this is in the case of saliva testing, some microbes that live in the oral microbiome make testosterone. So that was skewing the results. So as soon as I kind of had that piece of information, I'm like, well, that's too much of a wild card. I don't really want to be confused by that. So I stuck pretty much with blood testing. The other reason I like blood testing for measuring testosterone is you also get the SHBG, which I don't know if your listeners would know what that is. That's called sex hormone binding globulin. It's the protein made by our liver that binds up testosterone and estrogen as well. It's actually really important in women, and whether you have a low SHBG, which is typical of PCOS, or a high SHBG, which is typical of undereating, that can give you another picture, another angle, another insight into what's going on.
I love looking at sex hormone binding globulin. I find it really useful. In fact, and yeah, I've noticed too, I used to be a little bit leaning towards the saliva, and I dabble back and forth. I think if I've started someone on saliva, I stay on it because it's a good marker. But I have had really ridiculous high testosterone and progesterone levels that I could not make heads or tails of, and got the companies to repeat the tests. And so I'm leaning more towards blood more and more with my testing as well lately, because it just seems to be better. Just does. Let's talk about one last thing, and then we got to talk about your book. So. A lot of folks will come in to my office and they will have been dabbling with herbs on their own and trying to regulate their period. And the next thing you know, they come in and they say, you know what, I'm getting really heavy bleeding. I tried to do an estrogen cleanse because I thought that that's what was going on. And then I tried to, do my seed cycling because I found that online. And now every time I get a period, it's 10 days long. It's really heavy, lots of clots. What do I do? So, Dr. Lara.
Okay.
What do we do?
Right. Okay. So a period that is 10 days long and that is not coming regularly is pretty much a hallmark of a sign of an ovulatory cycle. So this is a word that it sounds complicated. It sounds maybe too clinical to remember, but I'll say it again. It's called an ovulatory cycle, a cycle where ovulation did not occur. This is a big deal. And this is a way more useful concept than anything like estrogen dominance. I just shared my blog post why I don't use the term estrogen dominance. I think that's confusing. It's sort of it's somewhat accurate term, but it's really not precise enough to know what's going on. If you have a cycle where you don't ovulate, well, for one thing, that's not really a cycle. That's actually not. That's just going to be a breakthrough bleed eventually, because ovulation is how we make progesterone. It's the main event of a cycle. It's what determines the length of the cycle as a normal cycle. Progesterone is also what controls the bleeding. Ultimately, it does good things to the lining of the uterus, to the endometrial lining, and therefore matures it and changes it in a way that when it sheds, when the lining sheds at the end of the cycle, when progesterone drops, then it will flow in a fairly controllable way, won't go on for too long, won't be too heavy. So as I say in my book, it's all about ovulation and asking the question, like, don't always be thinking about, do I have too much estrogen or not enough progesterone? It's like, take a step back. It's like, are you ovulating? And you can know that by tracking temperatures is a very simple way to know that yourself. And you can also try to test it with blood test by measuring progesterone at the right time. I have a blog post called "The Right Way to Test Progesterone." Don't be too dismayed if you test progesterone on a random day or something, and see a low progesterone. That doesn't necessarily mean anything, because if you have a longer cycle, you will have zero progesterone for most of the cycle, and that's normal. Not zero, but close to zero. And then, you need to ask this question: am I ovulating? And if the answer is no, then the next part of the flow chart, the next question is, okay, why not? And if the typical, what you just described, like a 10-day cycle and irregular cycles, that's an anovulatory cycle of PCOS. That's pretty typically PCOS. It might be other things, but that's when you really need to ask again. Even if the doctor said, you don't have PCOS because your ultrasound is normal. No, just ignore that.
I hear
that doesn't.
all
Yeah,
the time.
that an ultrasound cannot diagnose PCOS. It can't diagnose it. It can't diagnose it. It can't rule it out. You could have polycystic ovaries or not, and you could be normal or have PCOS. There's really just not a correlation like that. So I'm really trying to get that message out there to not worry, to not focus on that particular ultrasound finding, because it's just not helpful.
Yeah.
So the question is, if you have anovulation, it's probably PCOS unless proven otherwise. And then the next question is, okay, how do I reverse that? And then that starts, going into the territory of, is it insulin resistant PCOS? Is there something else going on? Are your male hormones high? And working from that angle.
I love it. And I'm guessing your book, The Period Repair Manual, goes through this step by step to kind of help someone kind of guide them through, okay, if I'm not ovulating, then yes, what is the issue and how do I find these answers?
Yeah. So chapter 7, as I said, is all about, it's the biggest chapter of the book. It's all about irregular periods and PCOS. And hopefully with the set of questions there I provide for the doctor and just working through the different possibilities, hopefully that brings women, at least a little bit closer to knowing the main reason that they're not ovulating and correcting that. And then as soon as you start to ovulate, you make progesterone, and then your period is going to lighten. It's going to be, a shorter number of days. And you can also, as we said earlier, you can take progesterone. That's an option. But taking progesterone doesn't get around the fact that you still need, if you're a young woman, you still want to ovulate to make your own as well. You don't want to just at the age of 30, just be content. You would never want to say, oh, I can't ovulate, therefore I'll take progesterone. It's like, no, you can, at 30, you can ovulate. Maybe at 48, maybe not. But a young woman, yes, you should be able to ovulate.
Absolutely. Absolutely. No, I agree. And I think for a lot of people out there, I think there's just a lot of not crazy. Let's just put it this way. There's a lot of hype online. And I love the post that you were talking about vegans, because vegans, vegetarians, under eating, dietary restrictions, let's face it, us ladies have a lot of issues with food. And not everybody, but there's a very high percentage of ladies who have, maybe not self-diagnosed not diagnosed, but eating disorder-like behavior that really can mess with their periods. And
the period is very sensitive to food supply. And it makes sense if you just think about it from a biological point of view, because I'm a biologist first and foremost. That was my training before becoming a naturopathic doctor. And it makes sense that because we, as women, we have to, ultimately our body's expecting to have to make a baby, whether you ever want a baby or not. That's of course your choice. I don't think it's not about that. It's about the fact that that's the way your biology works. It's expecting to have to make a baby. Everything is calibrated to that. So of course it's going to be sensitive to food supply and understanding if there's enough food coming in and enough nutrition in general. And so for that reasons, there are lots of ways to lose a period. Either low carb, we mentioned, or vegan diet is another way potentially to stop ovulating, which makes me very sad because actually recovering from a vegan diet can take quite a while, quite a few months, I would say, if not years, to recover some of that nutritional deficiency. And so if you think about it that way, it makes sense. And also one of my key messages for women is that it's normal to be hungry. It's normal to need food. Your body needs food. I would argue that actually as women, we have a higher requirement potentially for protein, for zinc, for taurine, for choline, for all these nutrients than men. We're more sensitive to their intake. So it's about kind of flipping the script and not just always be thinking, what foods do I need to avoid, but what foods do I need to nourish myself? And just recognize that we have the kind of biology that needs optimal full nourishment.
Absolutely. Absolutely. And I'm hoping you have a chapter in your book on dietary thoughts.
Yeah. I have a chapter called General Maintenance for periods. So it's about, I have a big section on eating enough. And, just asking the very simple question, which I is what I use with my patients. It's what I like. It's like, just say to yourself, okay, did I get enough to eat yesterday or today? Did I feel satisfied with what I ate? Did that all make me feel good? And that's ultimately the message, is like, you should feel satisfied with your diet. I'm not a fan of the kind of dieting where you feel deprived or hungry at the end of the day. That's just not working. That's not a good solution.
Mm-hmm. No, I absolutely agree. As my podcast listeners know, I am an N of one. I've experimented with all kinds of different things just to see what would happen to my body. And I have stopped my period with low carb diets and over exercising. I have messed with all kinds of things and that you're explaining in this right now. And so it's great to hear someone else besides me say it. Probably also for my patients that listen to my podcast too, that it's not, it's common and it's not just me that's experienced these things. There are other people. We are seeing patterns, and that's what we want to get the information across to folks. So now, Period Repair Manual, it's on Amazon. Where else can folks find your book?
Yeah, it's on a few online bookstores, a lot of bookshops, on iTunes, Kobo, all the usual channels.
Perfect.
And they can, if anyone wants a free download of the first 2 chapters, you can get that from my website. You just have to go on and sign up for my newsletter, and you get an instant download of the the first 2 chapters.
And I also see it's in German and Spanish.
Yeah.
Which is awesome. Yeah. Spanish in particular, I have a lot of ladies in my practice who speak Spanish, so that could be fun for them to read and pass on to some friends as well. Yes. So I think that everyone that is a woman that has their period currently and wants to get things dialed in, even to dial in for fertility, because as we talked about ovulation being the main event, what a better way than reading the Period Repair Manual to get things all dialed in to optimize your fertility.
Yeah, definitely.
So, Lara, thank you so much for coming on my podcast. I appreciate it.
It's a great conversation, Jen. Thank you for having me.
I can't wait to read your book. I wish I could have read it before this podcast, but I'm going to be reading it, and we will be putting it out. I will put it in I have books out in my waiting room. I'm going to have this out there so that folks can dabble in it and take a look. Might have to put a lock on it so no one takes it home with them, because I have a feeling this is going to be a hot one. And yeah, I just can't say enough about this. The period is huge. I think a lot of ladies, and I think the fellows out there that might be listening to this for their ladies, I think you guys, this could be huge. Something to pass on the information. So thank you so much for coming on. I really appreciate it.
Yeah, thanks.
Wow. I hope that you guys learned a lot of information from that podcast. Dr. Briden is amazing, and her book, Period Repair Manual, is great as well. So head on over to Amazon or wherever you buy your books and grab her book. Now, if you are also looking for some information in the meantime, head over to her website at larabriden.com, LARABRIDEN.com. She's got a great blog with a lot of great information. Sign up for her newsletter, and you can learn all about how to get your period on point. Alrighty, have a great day, whatever you're doing. Hey everybody, Dr. Janine Krause here. If you liked what you heard today, then head over to drjkrausend.com to find my free resources and information to know when I post something new that's juicy that you might want to check out. Plus, head over to where you get your podcasts and subscribe, and write a review to help get the word out about me and help others at the same time to find me. It really does help, and I really appreciate all of your reviews.